Okay. Good morning to one and all. So, on the behalf of College of Engineering Fulton, I would like to welcome and introduce respected Dr. Arun Jamkar sir, former Vice Chancellor, Maharashtra University of Health Science, and he is also on the management of persistent committee. So, I would request sir to take over the session. Thank you.
Thank you.
Yes, thank you.
I will.
Yes, sir. The slides are filled now.
Can you see the screen?
Yes, sir.
Okay.
Yes, sir.
Thank you, Ajay, for inviting for this conference. I'm extremely happy to present
Yes, sir.
various success stories in medical imaging. And I thank Society for the Cancer Research and Communication for considering my presentation for this symposium, where they are going to discuss about medical imaging 2020. So I thank all the organizers for inviting me for this session. I'm a surgeon by profession. I was professor of surgery, then dean, and then subsequently I became vice chancellor of the state medical university. But after I left that job, I'm consultant with persistent systems, where I got fascinated by whole approach of artificial intelligence. I'm working on technology, and if you go to my website arunzamkar.com, where the details of this speech would be there, including a PDF file of presentation, and that technology is only going to solve the problems of health in India. So the success stories of medical imaging are far more important, because in recent past there are several success stories of medical imaging. Now, so far we had been talking about face recognition that we get in Facebook or Google Photo, and where then we get fascinated that how come all our pictures are combined together, but they all use machine learning and deep learning. So this whole thing is an artificial intelligence, where artificial intelligence, what you call, is a machine who tries to think, and machine tries to think like a man. And therefore actually the oldest definition of John McCarthy, who says machine with intelligent behavior such as perception, reasoning, learning, communication, and ability to perform human task. And because of the imaging is one thing where a lot of ideas are coming, and for imaging you require a graphic what you call a GPU, graphic processor. And then the growth of graphic processor is going faster than CPU, and which is not following what's called the Moore's law. And now this is the chairman, CEO of NVIDIA, who is showing that the Titan X, say new chip, is in the new bounds. And therefore, when I visited this place, there was a mural where whole NVIDIA proudly wears that I am AI. Now, I'm not just going to go details, because all of you know about artificial intelligence, machine learning, deep learning. So artificial intelligence, as I said, machine is trying to think, and therefore they are using logics, if and then rules. But whereas the machine learning is something where we give them data, and then data is being handled in such a way that it can learn by itself. And then the deep learning is still a subset of machine learning, where there are several algorithms, software to train itself to perform tasks. That's why the image recognition, speech recognition, everything comes under, say, deep learning. And there are three main paradigms of AI: the symbolic, what's called a logic-based, or say knowledge-based, and image handling, it becomes a logic-based. Then statistical, where whole of the say number things are coming in that, and sub-symbolic. These are the three paradigms. And everybody is worried about what AI will do in near future. Current state, we are almost parallel, but then in future, AI might cross the human intelligence. At the same time, whenever we are say training for AI, that the AI, once it attains standard, it will train humans, and therefore the competence of AI intelligence will improve your intelligence as well. And as now there is a several knowledge going on, especially after say corona, say pandemic. And I'm just because all of you are students now, there's a nice website called COVID-19 Research Explorer, which is a AI based analysis of the cognitive domain, where you put anything about AI in COVID or anything, it gives you all the references available. And there's another called as a COVID Scholar. So now today's talk is about medical imaging and what are the success stories. And imaging, you get various images, say information about CT scans, ultrasound, MRI, then you have pathology image, endoscopy image, and for that matter, any image in medicine can be taken. You can take an image from electron microscope, you can take image from ultrasound, but I think ultrasound imaging becomes little more difficult. And whenever the image is given to you, it goes into this what's called the image handling process. So an image, what's called the data preparation. And then once your image, you need to integrate and clean to get it into your required format. You might require DICOM, you might require JPEG, whatever format you want. And then what is required is here you require a consultant who knows about image, and then he gives you say what you call as particulars of that image in what is called the physical format, maybe contour, maybe the color. Then through that you develop a feature engineering cycle. And then once you have a feature engineering cycle, you generate in consultation with the expert a features which are say features of selective that particular pathology or particular thing, and to develop into a model. And once you have a model, now you know that these are the features of that model. We create an algorithm to train that model. Once you train that model, let us say it's an X-ray chest. So you are training that model for some pneumonia or something, and then you extract. Once it extract, it becomes a either Python file, and you deploy. When the trained model comes, the new image comes, it matches. This is the image handling say process. And I think to be brief, so we have a label data, say let us say Tom, Jerry, and then you do data cleaning and do put on work on algorithms, and at the end the output of a given image will be either Jerry or Tom. So this the moment you give any image with which has a Jerry, it will call it Jerry. So these are all actually deep learning things, but then machine learning is something which is not much useful except for the cognitive domain analysis. But then machine learning tries to give a data analysis. And then machine learning, you have two types, what is called a supervised machine learning, where we give a label data. And once you give label data, any data that is given is classified, and then you can have what you call as a new algorithms develop on that. So data is labeled, and then we have something called as unsupervised machine learning, where no data is given, but then the system itself, it classifies and clusters, and then once it clusters, it goes into further classification and putting them together. And then what then we call as a k-means clustering, hierarchical clustering, Gaussian mixed clustering, and with all these clusters are going to lead further. Whereas in supervised learning, we have a reclassification and regression, and where you go into all the support vector machine. These are all say various algorithms available, and I think everybody have you need to understand about these algorithms and the competence and efficiency of these algorithms further. Now in a deep learning, we are going beyond. So what is important is the deep learning algorithms give complex operations, and then the feature extraction, everything is under deep learning, and then say it achieves best performance because they are better than machine learning. And what is happening is in the say deep learning, we have various types of network, what is called as a CNN, so convoluted neural network, where we are trying to follow the nerve system and how it works, and then all image handling is done through a CNN. Whereas if you have say mathematical data, then you have to go ANM, and if it's a time scale data, you have to go on RNN. But then for us, it is what is called as CNN. Now in CNN we have features. I say there is actually a very nice video available on how you do CNN, and then how does it how does each hidden layer comes. So suppose we are talking about Arun, then all A will come in the first filter, all R will come in second filter, or U will become in third filter, or N will become in all four filter. So depending on the complexities, the hidden layers are there. So what is required is in a given image, all these contours, all these physical properties are put in each layer, and the output is given. So this is how it works. Now, this whole thing is not very hard, not very difficult. As an engineering student, we need to understand that whole process is very easily available. You can go to these websites. These are the TensorFlow and Keras and Torch. And I'm just proudly saying to you that in one of my talk in MIT ADT, I was talking about say image handling, and then one boy who rang me up and said, "Can you give me some images of X-ray chest?" And then I gave him several images, and subsequently I helped him to find out how the classification is done. And then he was using a TensorFlow data of an COVID pneumonia and non-COVID pneumonia. And subsequently, when I was trying to follow him, I said, "What are you doing? So, are you doing B? Which year you are?" I was I was wonderstruck. He said, "I am in 12th standard," and then all this project he was doing for getting a better university in US. So there is no limit. If a 12th standard boy can do this, I think all engineering students can do it. So what is required is to look out of box. I'm just giving you a small video where they are talking about the medical imaging.
About this. So joining us now is our expert Tommaso. Tommaso, great to have you.
Thank you. Nice to meet you, Chris.
So maybe you can tell us in what areas artificial intelligence is already integrated into the daily workflow.
As you may know, as part of the clinical workflow of radiotherapy, one needs to contour the organs at risk because basically you want to avoid them during the intervention. You want to preserve them. You don't want to kill these organs. And this is a tedious process. It takes time. It's costly. The clinician has to contour all the organs. And this is exactly a perfect example where AI can make an impact by providing automation and therefore help streamline the contouring process and increase the throughput of radiotherapy sites.
Okay.
And this is just an example of out of the 30 plus products that we are here that are already AI powered. You can check them out on the booth.
You know what? That's an invitation. So why don't we do that? Let's go check them out. Now let's have a closer look at how AI is expanding precision medicine with the help of this brand new device here presented at the RSNA 2017. And with that, I'd like to welcome our expert, Mark. Mark, great to have you.
How you doing?
I've got to tell you, I've never been on a scanner like this before. So what's so special about this?
Yeah, so what we're introducing this year at RSNA is the fast integrated workflow with the new fast 3D camera just above you there.
Okay.
Basically, this is powered by artificial intelligence. We've got a lot of algorithms in there working as soon as I press one button
Okay.
to position you properly. So in the past, we used to have to do all of this manually, but now what it's done is determined where you are lying on the table, whether you're head first or feet first. It's already checked the position from shoulder to hip and the perfect isocentering as well. So now you're ready to be scanned.
Uh-oh. Oh, I got to tell you, Mark, this is kind of comfortable.
Certainly is, but we don't want you on there for too long.
Now, I know what you're thinking, but no, this is not a game chair. I'm trying to find out how AI is actually changing the way radiologists work. So for this, I'd like to welcome our expert, Valentin.
Hi, Chris. How are you doing?
Nice to have you. So maybe you can tell me how this actually works. What is this about?
In our advanced visualization software, Syngovia, already today we make use of a broad portfolio of AI-powered algorithms to help radiologists in their reading.
So maybe you can give us a specific example of how to assist radiologists?
Absolutely. So one tool we have newly introduced now with Syngovia DB30 is that the software is supporting the radiologists by automatically segmenting for them the lung, the heart, and the aorta. And all that is powered by AI algorithms.
That is amazing.
This is really great.
You mind if I stick around a little bit? And try
Not at all. Go for it.
about this?
So this is actually a commercial video from say Siemens headliners, where they are talking about all 50, 60 types of radiology, say image handling. So let us go one by one. So this is a list of success stories in the skin diseases, diabetic retinopathy, say ophthalmic diseases. There are several in radiology, but there's still more in endoscopy, in coronaries, and then the whole attention of world was driven towards a Google paper on mammography. In recent past, we are talking about how AI system is helping in coronal radiology and say digital pathology. So I'm just trying to give you one by one. So let us say the first simple thing is skin. Now we have skin disease, and then you have some small allergies or something, and therefore this is the paper of nature. Now all this presentation carries references down, and they are all you can click and it will go to the reference. So this is the one where with the CNN network, any image of a skin disease is matched through a deep learning technique, and then diagnosis is given, and then the performance was as good as 21 board certified dermatologists. So I think this is the some of the best success stories of having image handling competence in skin. And then now any success stories carries meaning when it is available for a general use, for the general purpose. Now sometimes you get small allergies, some maybe some small lesions. It could be even say insect bite or something, and you are worried. And every time you don't have a dermatologist available. Now I came across this site called First Derm, where they have what's called a skin image search, where all the images of various common pathologies are given. And the best part of the story is you have some skin disease, you just take a photograph, upload, and then you require two photos, maybe two angles, and then it goes up, and gives analysis, and at the end it gives a diagnosis. And at the end it gives a diagnosis and these are usually for US, that if you want a board certified dermatology talk, then only they charge. And this whole thing is available in India. I have some small lesion and I uploaded, and the diagnosis was exactly like my dermatologist. I think this is what a success story would mean. Same thing is happening with the diabetic retinopathy. And diabetic retinopathy, all image handling is simple because the training is easy. The variations of images in diabetic retinopathy are less, and therefore this is the one which has been approved by FDA for screening diabetic retinopathy. Now, in a diabetic retinopathy, I hope you all know retina is the part of the back part of the eye where the say images are perceived through the light, and therefore in a diabetes you get various changes, and these are preventable, and these usually happen with uncontrolled diabetes, and therefore screening will help them to control the diabetes as well as to control their vision. And therefore this is the one thing which screening is done. You require a small machine, and then you can have actually some programs where actually you need to have fundoscope, so it can't be having in say mobile, but I think there are some mobile app coming which can look at the retina. And now these are the paper given below which say the diabetic retinopathy is 95.8%, and I think this is something which is more important. Now going further, because all the images are in the localized area are available in eye, and therefore I hope you all know optic nerve is the one which takes image perception from the eye to the brain, and anything that happening in the optic disc. So these abnormalities can be diagnosed by say AI technique, and this is the paper giving you the competence. Then sometimes the tension within the eyeball can increase, and then glaucoma detection can be done. And this is another paper which is required. Now glaucoma is something where there is increased pressure of the eye, and then which say which affects your eyeball say vision afterwards. So this is about say diabetic retinopathy and ophthalmic diseases. Now let us go to radiology. Now radiology is where all X-rays are taken. So all X-rays, they can be say analyzed with AI technique. So it could be X-ray chest, and the common things are like pneumonia, when you have cough or something and there is solidification of lung. Then we could have vertebral fractures, then nodules, Then you can have all the scans. Now the CT scan. Now the top image is of CT scan, where you get several images. Then we are called MRI scan. Now CT scan is radiology. It's about X-ray, whereas MRI scan is magnetic resonance imaging. All of you need to put attention to understand what is MRI. And then the last one is called the PET scan, what is called the positive positron say emission say uh, topography. So all of these things are together. I've just given you images, and everywhere they can have a 3D images coming through technology. And let us say, so these are all again coming to the Siemens side. So MR for brain, for the chest, for the X-rays, all organ there can come together. And now I'm giving you some evidences. Now this is one of the say biggest series. Now while you train the images for AI or maybe deep learning, the most important thing is it requires very large number of images. Now this dual net was one of the deep learning network. They did two things. One, they took two views, a frontal that is taken X-ray from say in front, and lateral that is from side. And then there are 47,000 say 4,073 4,73,000 X-rays. And as a net result, once you have trained this model on the right side, you can see the various pathologies available which can be diagnosed. And this is the paper, and you can see the reference, and you can see that the dual net, it was almost giving like an say radiologist. Then going further, now this is another paper from this is how the AI will work. And then you can see all these pathologies which can see, and then there's a calibration done. And what you can see now is we going further the algorithms and how the radiologist, and you can see everywhere the algorithms are no difference with radiologist. So I think this is one of the best evidence of success stories. Then we have MRIs, what's called as a MRA, that is magnetic resonance, and through all of them. And then what is required now? This is about the PET scan. And in a PET scan, the peculiarity of PET scan is all that dye goes exactly into the cancer. On the PET scan, therefore, it shows you the positive evidence of cancer. Now, this is about multiple myeloma, where it's a say cancer of the bone, and it affects all the bones. So the advantage is we may not able to scan everything in the body, whereas an AI system with a deep learning, this is going as a GA pentaxy for PET scan. And the advantage of this is it is going to look after all the lesions in your body. And at the end, everything has where you take an X-ray, X-ray is available, but it's no radiologist. Now Chester, the AI, and now AI radiology assistant, they can upload these images and then give a diagnosis. Now here I must mention that all deep learning techniques are not going to replace radiologists at all, and they are going to just assist radiologists. But then what happens? X-ray is a norm, and therefore it takes long time to detect abnormality. Whereas an AI system will give you one clue that there is no abnormality at all. If it is going to help radiologists, instead of say 100 X-rays being screened and diagnosed by radiologist, instead of say 100 X-rays being screened and diagnosed by radiologist, now that is the advantage of given the choice. What is required is can we do something in corona, because suddenly we require too many radiologists and too many X-rays, and therefore we have an AI system available with a, now it suddenly changed the workflow that patient gets scanned, it goes into DICOM, it's a type of image, what is called as image handling software, and then the scan, the images will be scanned and it will go to the cloud, where they will do a parallel processing, and then the diagnosis is available and the radiologist can see and confirm. So this is how the whole thing is changing, and this is one of the company called RISES, where they are doing a lot of things in AI radiology for the chest, and where the precision is coming. And then they have said that if you do several serial X-rays, then it will be going to happen and give more diagnosis. Now, what is important is to differentiate between a COVID pneumonia and non-COVID pneumonia. So, what we are interested is to find out earliest changes of COVID pneumonia before radiologists the image to the visual. Therefore, can go beyond and look after the physical properties, and therefore the physical properties are more important. And therefore, what is required now? This is a homework for all of you. That suppose we have a patient, you take 10 X-rays, and he's quite positive afterwards. So you need to scan all his early X-rays where they were showing normal, and find out whether there are any physical properties in those X-rays. I think that will help, and maybe we can diagnose it early. And this is correlation of chest X-ray with the previous series, where it gives you a perfect thing. Hello, okay. So now there was another guy from Ahmedabad who was trying to do an accurate diagnosis of COVID pneumonia, say with a CT scan, and then he was able to do it. And what is required is here, which are early, and then positive. So I think this is about the COVID. AI system in mammography. Mammography is taking an X-ray of breast, and it the cancer very early. And these are the mammograms. And then all these mammograms, they show all this configuration with all these opacities. And these opacities, they have say peculiar characteristics. And then we can go and find out giving in mammographic density, and then you have to train, and then you can see that the accuracy is coming very high. And the computer vision and say AI system, you can see this is another paper which say the radiology residents and then attending radiologists and neural network. The accuracy is going high and high. And this is another paper which has come in Nature, where they had a large number of patients, maybe 25 and 3,000, where all these mammograms were shown to radiologists, and then the AI system with a deep learning technique was compared, and then the technique was better than 8 radiologists. This came as one of the biggest surprise, and this was a paper in Nature. It's again in Google platform, which attracted. I think this is one of the best success stories, because mammography need to be done regular screening, and therefore screening. When the moment you do screening, you have a lot of data, and I think it will reduce the workload of radiologists. Let us go to the endoscopy. In an endoscopy, we are talking about gastroendoscopy, where you pass a tube through the mouth, and then we go pass the endoscope down, and then we have direct endoscopy and virtual endoscopy. So a direct endoscopy, you go down and look at it, and then there are three types. One, you pass through the mouth, and then it goes to the food, what's called esophagus, then stomach and duodenum, and then all those images can be seen. Whereas in lower gastroendoscopy, you pass through the rectum of the colon, that's called cecum. And now the problem is the rest remaining say bowel is not seen, and therefore we have what is called as a capsule endoscopy. And then all these endoscopy can be done without doing any scope say inside. It is what is called as a virtual endoscopy, and this is we have virtual endoscopy which develops through the CT scan and MRI. So let us go. What are the success stories endoscope? And then they were checking about say peptic ulcer, what is called as acid peptic disease, very good acidity. and because of this infection. And you can see the sensitivity is very high. This again the deep learning technique with the hidden layers. Then other thing is in Japan, the cancer of the stomach is very common, where they are doing all these with AI technique. And what is important is that they take a biopsy, and then that biopsy is submitted. And now there's a new technique available where you need not cut. I'm going to talk in digital pathology again. But then this whole thing can be diagnosed. I think this is one of the most success story where the through gastroscope take a sample. I'm just trying to talk about capsule endoscopy, and this is in capsule, and where you have to swallow that capsule. That capsule is a camera which takes the image and sends the image outside, and then we have a transmitter, and therefore this reminds you of what is called as the Fantastic Voyage. It was a movie where the people were miniaturized and were left inside the blood, and then they go inside, and in capsule endoscopy you are almost doing same thing. Now in the capsule endoscopy, what happens is while you say eat that capsule and sending the image, several images come, in thousands of images come, and then it's physically impossible. And therefore we have a deep learning technique where endoscope using say k nearest neighbor, then SVM. So these are on the left side. You can see all the deep, say, machine learning techniques being used for wireless, and then you can see the sensitivity is almost 77 to 85%. I think this is helping, say, endoscopists to give you better results. Then same thing about endoscopy images. Another paper by Yuhan, where you can see these are the hidden layer. These are about the deep learning, where they are diagnosing what we called as a polyp within the small bowel. And then you can see these are the all say pathologies. You have bubble, the turbid, the clear image, the polyp, and then it is entirely this paper of Yuan is going up to 98%. I think this is something which is very important. Then we go to virtual colonoscopy, where the it's on CT scan or MRI, and these are the computed say polyps, which are another paper where they are showing you far better results. And obviously it became complicated, so we require so much of deep layers, say hidden layers, as because it's very complicated. So again, this is showing you far better results. What I'm going to do is I'm going to show you how exactly a chronic polyp detection is done.
And the analysis of the motion of the endoscope. One main contribution is the automatic localization of polyps in clinical colonoscopy. Colonoscopy consists of two different phases, insertion and withdrawal. During the insertion phase, the colonoscopist brings the withdrawal phase, the actual intervention is performed. An image can be viewed as a 3D representation in which shadows correspond to valleys. In colonoscopy images, these valleys correspond to shadows created by the polyp. We first clean the image. We integrate valley information in an intelligent way to highlight those areas of the image more likely to contain a polyp. The final outcome is a heat map in which the hottest point corresponds to the presence of the polyp. We verified that this map corresponds to the actual regions that attract the attention of the physicians. We validated this by means of eye-tracking experiments.
So this is about colonic polyp recognition in US. The colonic carcinoma is very common. and everybody undertakes colonoscopy at least once in a year. So this is going to help you to detect all those colonic, or I just showed you that those gastric cancer, we can do a digital pathology techniques. Actually, digital pathology was permitted far before, because the FDA permitted diabetic retinopathy in 2018, and 2017 digital pathology was there. I think digital pathology, the most important thing is the say what is called as there are a finite system, because all those images are in multiple, and same thing is followed with say image processing, the say handling configuration, catching them, and then say giving and the results, and then we can use machine learning techniques. So this is for a carcinoma of breast, which goes into the lymph nodes by spread, then we call it metastasis. And then you can see that the multiple lymph nodes are there. There will be several, say maybe 1 dozen or more. All of them, they can be seen with the machine learning with histopathology. Now, pathology and precision oncology, where whole slide images are there, and then they're enabling the subvisual morphological phenotypes, and therefore improve the patient management. So what they're doing now is once when they see nowadays the digital pathology is coming. Now I hope you all know that once you take a tissue, it is put in what's called the paraffin in microns, and then they put on a slide, and then they stain, and they look under the microscope. Nowadays, once they look under the microscope, that whole images are scanned and creating a digital say data. Now, once you have seen that, you can have what is called the handcrafted approach, and you can diagnose them further. Now, what is going? This is, I think, biggest success story going on. Is instead, because suppose you have a tissue and your pathology of that patient is not in that layer, and it's somewhere below, which might miss. Now they are generating a 3D images of all specimen, like a 3D virtual colonoscopy, and therefore what they are doing is give a tissue, and it converts into a large 3D image, and then the AI, the deep learning technique can all of do. Now this is all these are the startups which are working. The list is in the top, and therefore I think this is one of the biggest success story that is happening, that which is going to give the 3D images of the tissues and improving whole diagnosis far more. And obviously for these 3D images you require a deep learning technique. It is humanly impossible for a pathologist to do, and now this has directly come to the theater. Now you operate, and there is a tumor, and before doing anything for that tumor, you take a small sample called as biopsy. And earlier we were doing what you called as say taking sections under refrigeration, called say freezing techniques. It's called frozen section, and then whole thing is going, and then it goes to pathology. Now, here, what is doing is they are utilizing that whole technique into 3D pathology.
I think that's part of that opportunity.
Now the tissue is taken, we put on the holder, and then directly put inside. The whole tissue is seen with various layers, and in processing images, and within minutes, it will give you diagnosis on the table. So I think it's one of the biggest success story that a deep learning technique is giving you opportunity to get the tissue in operation theater where you are uploading and to the cloud, say protocol available, it is giving you diagnosis. And obviously, there is a nice paper where the AI system for the neuro-oncology. I think this is another paper which is showing you how it is done. And obviously, it requires a pathologist because there is a loop midway where some pathologists will validate. But then it has become very easy. Lastly, let us talk on coronary angiography because coronary angiography, where what you do is you pass a catheter to the vein in the thigh and goes to the lung, and then you can see whole images inside. Now, what is required is once you go into the say heart artery of the heart, which is blocked, you see some blocks. It's called the plaques, and therefore the artery becomes narrow, and you need to find out what is the extent. Now you can do this either by passing a catheter. Nowadays, non-invasive techniques are available. What is called as a coronary CT angiography, and this whole thing can be done with a CNN technique to find out the extent of stenosis in everywhere in the coronary arteries. And obviously, we require all those same technique available. So this is, I think, one of the biggest advantage. So this is another paper which showing you coronary angiography with a CT can help. Now this is an sensitizing webinar for all students. So we need to find out that how we can use deep learning AI techniques for images. And we are in India where our population is trained. We have several X-rays, several pathologies, several things available where we can use the big data available for training. So most important thing is training. No, if you go to TensorFlow or the Keras, all these deep learning platforms are available. You need to download and let us take some small project and then find out, because all of them they are available. You need to modify. You require small coding, and therefore I want all of you to think in this direction. That think out of box and create a deep learning model, create a AI based model to develop into pathology, say conclusions. And we have a data. You create a system, and then you can sell to the West. And because they don't have data, they can stop there. I think with this, I end to summarize the deep learning techniques and AI systems has been given several success stories in medical imaging, starting from skin pathologies, the diabetic retinopathy, then all about the remaining ophthalmic diseases, various types of images in endoscopy, then gastroendoscopy, it's a lower colonoscopy, virtual scopies, and then in the capsule endoscopy, then they can give you. I think I have given several success stories to see that how you can work. So thank you very much for your patience, please. Thank you.
Thank you. This was very exciting presentation. There are few questions which perhaps audience would like to listen from you again. For example, the first question is AI tools, how artificial intelligence, whether it is going to replace the present radiology or other disciplines, including similar pathology or other things which are there in medicine. So, what is your opinion about this?
No AI system is going to replace radiologists, because all the time you require radiologist. Radiologist is required to train first, because it's garbage in, garbage out, and therefore subsequently it is going to help radiologist to improve his competence. Suppose with the system, he will be doing more or 3 times more than the radiological diagnosis. But then problem is all these systems are unbiased. So suppose I am a radiologist, I look at an X-ray, I just look at some spado and I give diagnosis, and therefore visually I may not scan, whereas a deep learning technique will scan everything in the chest, and I think that will remove the bias. So that's why the accuracy of radiologists will improve. I think It is just to help radiologist.
So virtual endoscopy seems to be a very useful application, and without any pains, perhaps patient can get the diagnosis. So, are there any other things also similar to endoscopy where we can have painless diagnosis for the patients? Are there any examples, and whether we can explore some of the AI tools for that?
No, I think
Painless diagnosis. Like,
we are replacing what for the virtual colonoscopy, virtual gastroscopy, the CT scan. They are all virtual. Where you take a
yes.
CT image or MRI image, and they create a 3D model, and then 3D model gives you entire. Nowadays, all CT scans, they are creating a 3D model of a tumor. So before going inside to the operate, they are able to find out how is the what is the extent of tumor. Because I didn't say include that, because all these 3D CT images are helping to operate to find out the extent of disease, how much to be removed. And tomorrow you can suppose you are operating in laparoscopy, so you have a probe, and the moment you put it inside, you can have an AI system to tell you on the screen. So what are the deeper layers available? What are the structures available? How the artery is going? And usually for the anonymous or what is called as anomalous arteries, it will be very useful. I think this is future. Because I didn't like that. Even all surgeries they can use uh, deep learning techniques to help them.
Even image guided therapies could also be facilitated using AI tools now, because 10 years back, perhaps these tools were not there. But there also, we were just thinking of having something at research level, and even some equipment were available.
Yeah, I think that is future. Because of shortage of time, I didn't go into operative areas. And at the end, the robotics is coming through AI systems only. That once you have an AI system, it can direct, and then a robotic arm can operate depending upon the say input given before. But that is the future. Okay. Hello.
Something in between. So I just want to continue with the question. So the contrast agent which we inject, perhaps it is painful also. Sometimes we use piston pump and the contrast is injected. Sometimes it has some other effects like nausea and several difficulties with some patient. So are there any applications where our uh, contrast improvement could be made using this image processing AI tools and all?
No, we can't. Uh, no, there are several types of contrast. What you are talking about, those contrasts or which contain IOD. Now we are
Yes.
working more and more on non-iodinated contrast, where the
Ah.
reaction at the end anaphylaxis, but the reaction can happen to anything. But then we are trying to reduce the amount of iodine in that, and then in that case, the nausea, vomiting, the side effect is overcome. But then it's very small; it's not alarming, and it
Yeah.
can be taken care of by the
Yeah.
drugs immediately. Now, though you
Yeah. Going
require
from
some different contrast for MRI. It's called as
MRI.
FDG.
Yeah. Yes.
FDG. It can also give some reaction, but then
Yeah.
that is about because that FDG goes inside the cell and make them
Yeah.
say what you call as magnetic resonance competent,
Yes.
or that's why
Yes.
these are several guys out.
Yeah. For example, in MRI, we use T2 star contrast, so where we don't need exactly the physical contrast agent. In some cases, of course, they use contrast agent, but we use signal processing to enhance the contrast so that without contrast agent injection, also it may be possible. I think this is one area where our people are also working in some parts of the country. And there are several challenges because AI tools. Recently, I have seen in Bangalore, Satya Sai Baba Hospital. So some people are presenting on AI applications for automatic segmentation of MR images and diagnosis, automatic diagnosis. So presently now the automatic or semi-automatic, what will be compatible to radiology as such?
I think it's a very vast
Yes.
topic. I'm just,
Yeah.
I'm a surgeon. I have own
Yes.
limitations, and
Yeah.
maybe some
Yes. Yeah.
radiologists can talk who is well versed with using AI techniques. But they are now everybody is doing all these deep learning techniques.
Yes. So how these laboratories in hospitals are going to change with this modern AI and machine learning techniques? Uh,
No, that whole thing will be directed towards creating a data, uploading, say doing a parallel image processing, and therefore that, as I said, that theater, this is a new theater that otherwise take a sample and it is submitting directly uh, to a whole technology available in theater and uploading. And so I think this
yes.
whole thing will change. Now, on labs also, we have all not exactly AI systems, but then we have EHR, electronic health recording, and then whole thing goes, and then there's a cognitive domain analysis where even treatment management, patient management can be improved because at the end we can do a cluster techniques to find out
Yes.
which protocols are available. But I think that is about AI system being used for cognitive domain analysis. That's another thing which is
Yes.
available.
Yeah. So we have engineers as well as medical people. So what is your advice for engineering people? How they should go about these AI tools and what they can contribute to clinical technology?
I think the future of all technologies is going to be healthcare, and every country is going to spend more and more money in healthcare. Therefore, what is required is biomedical engineering, understanding between two interdisciplinary areas. Now, there was a nice TED talk which said that whole world was working about nuclear power and say nuclear disarmament and how to protect ourselves, and they were spending so much of money. And suddenly, when the virus like a corona came, we are not prepared. So we required more radiologists, more epidemiologists, more hospitals, more ventilators. I think this whole thing. Now, look at the future. Everybody will spend more money on healthcare. So more money means more people,
Yes.
more equipments, more gadgets, and more technology. Therefore, AI in health is one of the part, but then you need to work more on even medical equipments, better equipments, cheaper equipments to improve the quality of healthcare. I think this is future. So we need all of us to pay
Yeah.
more
Yeah.
attention to healthcare techniques.
Yeah. Sir, we were working on some clinical engineering and imaging technology course where medical people and engineering people were supposed to attend in the same classroom and do complementary studies. So, what will be your advice for engineers? For example, engineering college like us in Fulton, what we should do as far as this kind of biomedical or engineering studies are concerned, or mechanical
Now,
or electronics, computer?
given you success stories. So the hot topic is image processing. And I don't know how much time an B computer guy or maybe B electronic guy spends in image processing. So you should have one lab for image processing. What is
Yeah.
required is the data. So best way is go and get collaboration with some hospital where you have all the images available and then do into collaboration. And because, as I said, data is important for training. And therefore, once you train, you can train all your students and to go into all those finer details. And our students are far more intelligent. They will find out what are the new techniques available. So I think in a say even Fulton also because there is everything is on cloud. So I think we need to do
Yeah.
a special lab for image processing, especially medical image processing.
Yes. So even our computer experts, for example, our head of the computer department, Professor Bhagwade, you are going to set up some center. We were discussing about this center of excellence in imaging technology or in general image processing. So any question you want to ask to Dr. Jamkar, so that we get a vision to set up this center.
Yes, sir. Definitely, we can set up the center. Sir, can AI can also play a vital role for the human psychology?
Actually, this is, there's something called as affective computing. All the time we're thinking about cognitive domain, that is knowledge. But then affective computing is something you can just Google, and there are 10 platforms available for affective computing. I think one of those would be a hot area for you. So this is something where people do not know even today. So college like Fulton, you can talk of doing an affective computing. Affective means emotions, say feelings, everything. So I think this whole thing can come in the affective computing.
Yes.
Any other question from audience? So there was one question in chat box from, I'll just read it. From where we can get mammogram for engineering projects on cancer detection?
Actually, in Fulton also there might be several radiologists who are doing mammogram.
Yes.
So you have to contact and go into collaboration. And otherwise, I think online all the databases are available of mammogram.
Yeah.
In case you don't get anything, you can write to me. I can talk with one of my student and friend, Dr. Shekhar Kulkarni, who runs a charitable mammography clinic, and then he can give say mammograms.
Yeah. Or Dr. Abhijit.
Collaborating with us, and there might be, if you go to TensorFlow or anything, there might be already an AI system for mammography available. So what is required is to do all that.
So for beginning, what kind of course we should arrange? In fact, I was thinking that some background could be prepared in MRI, CT scan, and also some preparatory course, 3 months or so. I want to offer to this faculty and students so that they will be ready with some background and maybe few lectures on anatomy.
No, I'll advise you to read one book by C.K. Prahlad. He was talking about education innovations.
Yes.
And we never followed that, where he said N is equal to 1 and R is equal to G. This is a feature of education. N is equal to 1 means customized education. The student should learn what he wants to learn. And therefore, let us say we are creating this imaging or AI system course. It has to be customized. And second is R is equal to G. That means resources to be global. So what is suppose in a customized thing, you have 15 to 20 protocols or maybe modules available. You need to scan whole of the world and who are the experts. And everything is online. Therefore, create those program in such a way that suppose even if an image handling, all those big guys who has developed all these deep nets and chest nets and everything, they are available and they can give talk. So I think you think of R is equal to G. Sitting in Fulton, a guy from Stanford can talk better. And all these X-ray test and everything is the Stanford work. And there are YouTube videos about what is being done in Stanford. So I think you need to look into this direction, out of box. N is equal to 1, R is equal to G. If you read at the book of innovations from C.K. Prahlad, he was all, I think, the icon.
It's really very good direction to the new faculty members and students, and something like outside Pune or in rest of the Maharashtra where we can have global innovations also. So this kind of direction will definitely help us. So we would like to.
Post-COVID, everything is going to change.
Yeah.
Whole ecosystem is going to change. We were staying in city because our say companies were in the city. Now everybody is online. Why spend money in high-cost city life? So go to smaller place. People will come to Fulton now.
Yes. Yeah,
And
that is really interesting. Yeah.
so that people will come to Taluka place which are close by, where they can commute once in a month or once in a week. The remaining time they can have, say, pollution free life. So I think the whole
Yes.
thing is going to change with the COVID, that
Yeah.
everybody will be online,
Yeah.
and
Yes.
sanitary townships in the Taluka place close by can be
Yeah.
utilized. They will grow. So my
Yeah.
hypothesis is this is what you call as bliss in disguise.
Yeah, so this is going to be a very good, uh, favorable place for studies and research. A Patan-like
Yeah.
place where a lot of peace is there. We got enough space and a lot of greeneries and very pollution-free environment. That is going to encourage the studies for our people here, and we can take it to any level. Like we had
I want
Dr.
I want
Enrico, to, yeah,
Huh.
yeah, from Switzerland. So he
Basically,
presented that.
what is required is Wi-Fi.
Yes,
So internet, three things: road, electricity, and internet. The three things required
yes,
for. So I think we need to work in that direction. I think even priorities of the government will change.
yes.
Okay.
Any
Thank
last
you for.
question from audience? From, yes, sir. One more question if audience has, and then we conclude.
Yeah.
From computer science or electronics, anybody want to ask question? I think rarely we get opportunity like so. This is a very comfortable time which we are spending with Dr. Jamkar and his valuable uh, directions to all of us. Will definitely set a vision for this
Hello, sir.
institute and for our society. Yes, please ask. Professor Jagta, please ask.
Platform for image processing. Which is the best platform for image processing? In colleges, we are using the MATLAB currently
Yeah.
for image processing
Technically, we can do
and
that.
other tools.
Maybe MATLAB or
I think
anything.
people are using TensorFlow.
Yeah, TensorFlow.
Okay.
Have you seen my slide? I have shown you the several
Yes, sir. Yes.
all the list of platform, and I have made it such a way that you click on that, it will go to the website.
Okay, sir. Thank you.
And I think Google
So
it.
thank you, sir. We want to, yeah, yeah,
Anything in medicine or biomedicine or AI and all that. If any student wants to work on that, he can contact me, and I will help him whatever way I can.
thank
Thank
you, sir.
you.
We would like to have your directions continuously, and we will definitely show that something is getting created at Center of Excellence, and our people will start working on that. And also, along with Society for Cancer Research and Communication and our IIT Bombay people, a lot of researchers are getting connected with our faculty members also. And in addition to that, there are many groups, engineering faculties, students, research scholars from different organizations also, like from Pune, Mumbai also, they keep on interacting with the participants we have. And I think this will set a good ecosystem for carrying out the research. And we look for your constant guidance, and we'll definitely come out with some results in the near future. Thank you, sir.
Thank you.
Thank you.
Thank you.
Professor Goiti, madam, can you just provide your top thanks?
Yes, sir. But I think sir
Yes,
has
sir.
left.
Okay, but you can conclude the
Zamkar sir
session
has.
with something. Yeah, but you can conclude the session with whatever participants we have.
Yes. Actually, it's great for us that we got opportunity to listen from Zamkar sir on such a nice and informative session on medical science. Actually, he shared that shared recent innovation in medical imaging, Also, he given information that about application of machine learning, deep learning, and artificial intelligence in medical imaging. So I would like to thank him that he took out his valuable time for us from his very busy schedule. So I would like to thank our respected principal for arranging such a nice and informative session for all of us. Because of he only we got such an opportunity to attend nice sessions. Also, I would like to thank all faculty who attended this session. So I thank all again. So shall we conclude, sir, here?
Yes, yes, yeah. Thank you, Vita madam. We had a very nice interaction, and also for other industry meeting, we are going to discuss at 4:15. All HODs will join, and then all the other faculty members will join at 4:30 p.m. today. And I think for students also, it is a very good opportunity that we are getting good guidance and exposure to the right field, and people who are presenting lectures are very unique to those kind of areas where they have their own specialization, lot of work they have done, and then they are presenting to us. It's really a good opportunity that some engineering college like us is really lucky in this sense that you are connected to very topmost people in the world, like Dr. Jamkar, Dr. UB Desai, then Dr. Enrico Amico from Switzerland and University of Geneva. There are some more people who could not come so far due to time constraints because already they have a lot of scheduled lecture sessions and conferences, but they will be also coming to present at some or other point of time. Our Society for Cancer Research did one program. We did several programs with our Indian Academy of Industrial and Applicable Mathematics, our consortium of mathematics, and maybe the other Bhaskaracharya Pratishthan and Pune University Tiller Chair Professor. So that is another society. Our in International Society of Automation has already conducted some discussions. Similarly, we are having some other programs with our Indian Nuclear Society and several others, IEEE and several other societies also. Uh, so we are looking for very good lectures, and we have to be ready to work on several fronts. That is the challenge. So everybody's interest could be now channelized. Somebody want to work on image processing in medical imaging, or in image processing in civil engineering applications, water and land management. Somebody want to work on industrial applications of image processing and signal processing. Somebody want to work on maybe the new technology, industry 4.0, IoTs, data analytics. So there are several openings for the students which we are bringing here in Fulton, and our students and faculty will definitely benefit out of this. So I hope, let us get ready for all these things. There are so many things to do, but we have to also see the interests of people and how to channelize, how we can accommodate the best possible interest into the work in which they are getting into some projects or training or some of the conferences, symposia, colloquium. So we need to really find out how we can go as per the interest of people who are with us in the college. So for 700 students also, there are so many opportunities. Each one of them can work in a separate area, or they can club together and do some work in collaboration and with other outside areas also. For example, industry or hospital, or maybe we are also talking about some similar program on agriculture equipment. So agro-based industry is a different game again. So we'll provide so many opportunities for people who want to work on a particular sector. They can go with a particular direction. Of course, CWPRS has given a lot of opportunities. Jubilant, I have talked, and they are saying you also give some internship to your mechanical students and electronic students also. There are so many other industries. The persistent, now Dr. Jamkar is from persistent, so I request computer people that you wanted to get benefit out of this persistent system, and so many other companies will come. I can ask them to present certain things, like Infosys and many other Cognizant, and several companies are there for computer people also. So I think this is the best place where we are getting everything in our campus, and there are huge number of opportunities for people to work on, not only present students but past students and faculty members, and the kind of research exposure will be here is much valuable to people to create something as a new, and it could be a dream of this Fulton Education Society's College of Engineering. So thank you very much. I wish you all the best. And let us be with us whenever such programs are announced. Thank you.
Thank you, sir.
बागोडे सर आपण
Thank you, sir.
भेटू संवाद या मॅडम संवादला आपण ऑल एचओडीज
हो सर,
Yes,
हो
sir.
सर.
थँक्यू.